Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hi, everybody. Welcome to the Behavioral Corner. It's me again, Steve Martirano. I preside over this little bit of virtual turf. We are dedicated to talking about, everything, because everything is what ultimately affects our behavioral health. It's all brought to us by our great partners underwriting this program, Retreat Behavioral Health. You'll hear more about them a little bit down the road. So, people come by in the corner. We meet great people. They have great stories to tell. Lots of times, I hope they're enlightening and informative. And that'll be the case today. But before we get started, I got to give you the topic so you understand what's going on here. And you want to chase the kids out of the room. I don't know. Kids watch podcasts? I don't know. Anyway, we're talking sex. Got your attention now, don't I? Okay. And we're not just going to talk to the guys on the corner about sex. We're going to go to an expert, a gentleman who is, among many other expertise, is a certified sex therapist. Dr. Steve Eichel is our pal. He's been on the program before. He's a great resource. He is a licensed psychologist, and he ranges far and wide over a lot of therapeutic fields. Last time Steve was with us, we were talking about cults, which was a great show. Steve Eichel, thanks for joining us. Let's talk a little sex, shall we?
My pleasure.
So I see your bio, and your bio says that you are a certified sex therapist, which means there must be some problem going on here if people need therapy for something like sex. And I guess I'm not surprised that sex, when we think of a problem sex, we automatically use the phrase sex addiction. They're addicted to sex. I'm wondering whether that's not a misnomer, because as I understand it, sexual addiction does not appear in the diagnostic manual.
Right.
It's not considered a disorder, and it's rarely, you tell me, rarely diagnosed as a problem. If that's true, what are we talking about?
Well, I'm going to take slight issue with what you said. I think it's diagnosed a lot. However, it's not a formal diagnosis. Uh-huh. So you're referring to the fact that it does not appear in the DSM, the Diagnostic and Statistical Manual, that's published by the American Psychiatric Association. It's now in its fifth. Actually, there's a DSM-5 TR, so it's actually in depending on how you want to count it, it's either in the 6th or the 7th edition. And I bring that up because the DSM is an evolving document. It is a document of consensus. It is not a scientific fact. I personally don't, unless I'm forced to use the DSM, and when I say forced, that's through either a courtroom procedure when I do forensic psychology, or in the rare case where I'm involved with an insurance company, since I don't take insurance in general. That's when I have to assign a DSM code. Other than that, I don't think about it, because the DSM is a static document, and people are not static. People are dynamic. People move, they change. So, for example, with the bipolar disorder, let's say if I'm 70 years old and I had a manic episode 52 years ago when I was 18, one manic episode, that's it, never happened again, I still carry the diagnosis of bipolar disorder, which I think is absurd. But anyway, that's DSM.
Yeah, and the other great example is that was relatively a short period of time ago, certainly in my lifetime and yours, when homosexuality was considered a mental illness.
I was in college when it was declared no longer a mental illness.
This is not the dark ages we're talking about. Yeah, so it's a fluid thing. I just mentioned it because so much flows from that. In the ways you mentioned, but in the broader society, people go, "Come on,
all the time.
Come on, you're not having a problem. You just like sex." So what are we talking about? What is characterize the behavior of the people who come to you, if you can, in general, with a problem sexual?
Okay,
too much or too little?
What most people, what the sex therapy field tends to refer to is out of control or compulsive sexual behavior. So it's like any other behavior. It's like running or eating. So if you're so devoted to running that it begins to interfere with your personal life and your work life, well, then I guess you could say you have a running addiction. But of course, no one talks like that because running is valued. It's a positive behavior in the minds of most people. Sex is far more complicated, and I like to point out how we think differently about sex than we do about any other human behavior. And here's the example I'm going to give you. It's a weird one. If you'll follow along with me just for a bit.
If it's weird, I'll follow it.
Okay. So when a man walks into a men's room, you often will find a sign, you'll see a sign there, employees must wash their hands after using the bathroom. Well, think about this, okay? Your hands are the dirtiest part of your body. You touch everything with them, okay? Mm-hmm. A man's penis typically is behind at least 2 layers of clothing. It's not touching anything. Okay. You tell me, I think that rather than washing your hands after you touch your penis when you're urinating, you should wash your hands before you touch your penis, because it's not the penis that's going to make your hands dirty. It's your hands that are going to make your penis dirty. But we tell people to wash their hands afterwards because the penis is inherently dirty. That's why. So it's an unusual example, but it's an example I like to use to show how we often think very irrationally about sex. So again, with sexual quote unquote addiction or sexual compulsivity, the other, I will often remind people of that wonderful scene and I don't like to quote Woody Allen these days very much, but nevertheless, he did, Annie Hall was an Oscar-winning movie. And there's that great scene where it's a split screen and Annie Hall and the character played by Woody are both talking to their psychiatrists. And the psychiatrist says, "How often do you have sex?" And Woody says, "Hardly ever, twice a week." And Annie says, "All the time, twice a week." So you can see, it becomes extremely subjective at times. Yeah. The referrals I get are typically not so much for quote unquote sex addiction, but more specifically for quote unquote porn addiction.
Yes.
Okay, so and typically what happens is the most typical example, not only in my practice, but in the practices of most people that the literature that I read and the people that I talk to, the typical scenario is a wife calls up saying, "I discovered I was looking at my husband's computer and he forgot to close a window, and I realized, oh my God, look at this! The window is to Pornhub or Xhamster or one of the other free porn services." And then I went and looked at his history, and sure enough, tons and tons of times that he's activated the porn station or the porn service on his computer. Now he's got a porn addiction. All right. Up until then, everything was fine, but now he's got a porn addiction. That's the most typical kind of situation that I and a lot of other therapists run into. Now there's a problem. So
it's behavior driven. It's not so much what's going on here, but how you're acting on it.
That's right. How you're responding to it.
How you're responding to it.
Porn is still dirty, kind of like, going into the men's room, right? It's still a dirty thing. And of course, what women understand, and this is a problem, if a man is using, or a woman for that matter, if someone's using pornography as a way of avoiding sex with a partner, then it's a problem. Mm-hmm. For most people, though, the vast majority of people who use porn, they're using it in addition. And in some cases, they're using it in order to get inspired to have sex with a partner. There was a time, this rarely doesn't happen very much anymore, mostly because research doesn't really back it up. But there was a point in time when a lot of sex therapists would recommend to a couple that was having low sex, reduced sexual activity, they might recommend, you should watch some porn together. The research really hasn't shown that to be very effective at anything. So that's not being recommended. But there was a time when that was being recommended. So porn can be used as a way of arousing and inspiring someone
Yeah,
to engage in sexual behavior.
I've heard that some of the distinctions are that men are more visually aroused, can be aroused by vision, by images more readily than women can, who prefer probably written erotica or something less blatant. So yeah, it's a dicey situation there.
It is. And men, what we know in research is that men do tend to be more easily stimulated visually, but a lot of women are too.
Mm-hmm, mm-hmm.
The shows like, the Chippendales are very, very popular. Actually, what women tend to be turned on by, and I tell this to men a lot because men don't know this.
Okay.
Touch and smell. So one of the first things I recommend to men is, if you want to have, especially men who are having decreased sexual activity with their regular partners, I will tell them, do you shower?
Bathe more frequently.
Okay. You used to, when you were first dating, that's what you did routinely, right? Before a date, you would shower and get dressed nicely and brush your teeth and, comb your hair, whatever. And now you don't.
Some of the old verities are still true.
Yeah.
Cleanliness is not only next to godliness, but it could be next to your wife.
Yes, that's right.
Right.
That's right.
That's a great tip. That's a great tip. All right. So people come to you, though, that they are having problems. What kind of problems are they suffering from?
I would say the most common problem these days among males, and by the way, this is among young males, and I do believe it's related to pornography to some degree. The most common problem is difficulty getting erect. So erectile issues, not erectile disorder. All right, erectile issues. There's a difference. So they're having erectile issues, and especially they're having difficulty having orgasms. They're having difficulty completing the sex act. Mm-hmm. And that I do tie, at least to some degree, to overuse of pornography and overuse of masturbation, particular kinds of masturbation techniques that wind up desensitizing a male's penis to stimulation that is less stimulating than your own hand.
Wow. And you can that can be reversed by not watching as much porn and not masturbating as often.
That, among other things, yeah. It can be reversed. It takes time, and a lot of times, and understandably, people come in when they come in for sex therapy. A lot of times, the analogy I use is dentistry. The best thing to do is to go to your dentist every 6 months for a regular checkup.
Not when your tooth hurts.
And certainly not when your tooth is about to fall out. Okay. And a lot of times what people do with especially relationship therapy, marriage therapy or relationship therapy and sex therapy is they wait until, it's the very last thing that they can possibly do.
Do you see couples, by the way, in your practice?
Mostly, when it comes to sex therapy, I mostly see couples. I strongly prefer couples.
And that's the dynamic. There's something wrong with frequency or pleasure or interest.
Yes, typically I have seen a fair number of couples where the issue is sexless marriage.
Uh-huh.
Okay, so what do we mean by a sexless marriage? Actually, it's not a marriage where there's no sex. Most research protocols will refer to a sexless marriage as a marriage in which sex occurs. And by sex, I'm talking about any form of genital sex. That's another issue I want to get into. Most people, when they talk about sex, they're referring to what Dan Savage calls PIV sex, penis in vagina. And that is, of course, not the only form of sex, as we all know from Bill Clinton's days. So when I use the term sex, I'm referring to any form of genital contact, whether it's PIV or something else. But at any rate, they come in. A sexless marriage is generally defined as a marriage in which there are 5 sexual encounters a year or less. So if you're having sex once every other month, you're bordering, you're on the borderline of having a sexless marriage. I get a lot of referrals for that. It's either sexless marriage or it's quote quote unquote porn addiction, and occasionally I get referrals for couples who are struggling with working out open marriage or polyamory or some other form of consensual non-monogamy.
So those are probably more easily understood. They are by me anyway. But the stereotypical image or thought is of
Right.
an insatiable need for sex. Do you see people like that, and what's going on there?
Yeah, I certainly have seen people. I used to be on a regular referral list for sexual addiction. I don't think I am anymore because I think that my rejection, if you will, of the Carnes model of sexual addiction has put me on
describe that model.
Well, the whole term sexual addiction originated with a psychologist by the name of Patrick Carnes, who wrote the very first book on sexual addiction called Out of the Shadows. Mm-hmm. And I've trained with him. I trained pretty extensively with him. He's in many ways, he's been a very brilliant individual. But the treatment modality that's used in sexual addiction is based on Alcoholics Anonymous. It's a 12-step program, and I've seen that I've seen that abused by a lot of people, and so I'm deeply concerned about it.
Well, yeah, I mean, what immediately comes to mind if that's the model, if that's the standard addiction model, and that's the sort of natural approach, which is the 12 steps.
Right.
12 steps are predicated on getting to a point of sobriety. What would sobriety be sexually? What would that be?
Well, there are 4 what we call S groups. In other words, 4 different groups that use AA as their model. So the first one was Sexaholics Anonymous, SA. Then I don't remember if it's SAA or SCA. Well, anyway, Sexaholics Anonymous was the first one, and they were the strictest. So for them, sexual sobriety consists of sex only with your married partner. Now, that was a problem before there was gay marriage. So as you can imagine, there were very few. If you were gay,
it's also a problem insofar it sounds like that model doesn't take into account that being strictly monogamous with your partner in order to maintain your sobriety doesn't take into account that perhaps he or she is not interested in, your frequency of sex. I mean,
that's
if someone has an insatiable desire for sex and they're, jumping all over their spouse, they're not in any way healthy, are they?
Well, again, what does insatiable mean? You mean inability to please? I mean, that's very
or get pleasure.
Again, that's fair. That's a whole separate issue. So typically, people who are called sex addicts, the problem isn't that they can't get any pleasure. The problem is that they're so involved in the process that it interferes with other areas of their lives. All right, so. If I'm so obsessed with sex, that's the only thing I can do. I worked with a guy who spent on average 5 hours a day on porn sites. That's a lot of time. Now, obviously, he did not. He would masturbate a lot, but he wasn't having 50 orgasms. That's not humanly possible for a male. It is possible for a female, not possible for a male. He would it became so ritualized that he would just spend hours and hours and hours perusing porn to the point where, he wasn't having relationships. He was having difficulty at work. A lot of other areas of his life suffered as a result of that. So that follows a more classic compulsivity, or if you want to call it addiction. I'm also a certified addictions counselor, a master addictions counselor. And I'm a kind of old school. I think addiction relates to ingesting chemicals in your body. Mm-hmm. So alcohol, drugs, things, cigarettes, that to me is an addiction. The rest, I think, is more properly understood as compulsions.
Yes. So you're not wedded to this, the addiction model
I'm not.
This situation. Okay. I wonder how much of all sexual dysfunction and problems might be attributed to the fact that men and women feel very differently about sex. Is that true?
I'm going to reverse that statement and say that I think men and women think very differently about sex because of our cultural backgrounds, because of our society, because of Judeo-Christian tradition, etc. Again, as we were talking about a little bit about prior to this program, there is a model. There's what's referred to as a standard narrative, which is, and most people believe in this, and most scientists believe in this, and that the standard narrative is that men are inherently more sexual than women, that men are inherently non-monogamous, whereas women are inherently monogamous. That's not proved. Number one, that's not proven. Number two, there's archaeological evidence that prior to us humans becoming agriculturally based, settling down and living in areas rather than being nomadic hunter-gatherers, that in fact women were far more, if you want to call it promiscuous. They had far more sexual partners than they do now. There's an interesting anatomical feature to males that backs that up. Okay. And I'll get into that very briefly if that's okay.
Yeah, go ahead.
All right. Think about the male penis. Think about what it's shaped like and what it looks like. All right. The male penis in humans as well as in apes is engineered to scoop out the sperm that was in there before. Think about that for a moment. Think about the male penis, what it looks like, the ridges around the phallus.
Okay. Right.
So in other words, it's the idea here is that a woman would have multiple male sexual partners. The alpha male would not be the first one in. The alpha male would be the last one in, and his penis would scoop out the competing semen that was in there and leave his semen in there, and therefore make it more likely that when the woman gets pregnant, it'll be his child rather than some other man's. That's anatomical evidence for the idea that women were far more sexually available and permissive. But once we became agriculturally based, and we were no longer nomads, and things began, then you had to worry about property. You had to worry about, well, who's going to inherit the farm? I want my kid to inherit the farm, not someone else's kid.
So the interest in progeny and paternity became paramount.
That's right.
I'm not going to pass the estate on to a child that's not mine. It's interesting. So we're not hardwired to feel differently about sex.
That's one theory, is that we are not hardwired to think differently. And of course, as we all know, women are sexually superior to men. Alfred Kinsey had physical evidence with one woman who was able to have 100 orgasms in an hour. Okay, men, your average 25-year-old male, if he can have 2 orgasms or maybe three in an hour, that's pretty unusual.
Yeah, the average young male just wants the opportunity to have 1 or 2. The idea that 100 is possible is beyond imagination. So I'm fascinated about the fact that among the patients you're seeing, they are younger people rather than older people.
That's the big change. The big change 25 years ago or 30 years ago, the average, the stereotypical couple coming in for sex therapy would be the husband dragging his wife in because she's no longer interested in sex. All right. Now it's the opposite. I get mostly women dragging their men in, whether they're husbands or not, because the women are disappointed with the lack of frequency or the lack of attention, or the fact that my 25-year-old, 30-year-old male partner is having erectile issues or can't have an orgasm. I get a lot of referrals from, I work with a lot of couples and men who are having difficulty climaxing during partnered sex.
Under like 40 years of age.
Yes.
Yeah. On the other end of that spectrum, as people get older, what do we know about sex drives? Do they diminish with age at the same rate among men and women?
They diminish with lack of testosterone. They do diminish with age to a degree, in the same way that everything else tends to diminish with age. So, your physical activity in general might diminish. But again, there's tremendous variation among individuals. So, for example, a lot of women, the standard narrative is that when a woman reaches menopause and then is finished with a quote unquote change of life, that her drive drops tremendously. And that's true for many, many women, maybe even the majority of women. But there are also a lot of women who experience a resurgence because now I can't get pregnant. So they experience a resurgence of sexual desire. Mm-hmm. So it's far more common, in my clinical experience, far more common for a 65-year-old woman to drag her 65-year-old husband in for sex therapy than for a 65-year-old husband to drag his 50-year-old wife in for therapy, or a 55-year-old.
Fascinating. Our guest is Dr. Steve Eichel. He is a licensed psychologist, and he has done sex therapy, as you can tell, and many other practices as well. This is interesting on so many levels. Are any of the, and I'm loath to use the word dysfunction, but any of these problems, any of them associated with sex, treated with drugs?
Well, of course, the ED drugs are the big ones. So Viagra, Cialis,
yeah,
are all very popular. And by the way, the majority, if you look at the prescription rates for Viagra, which is, I think, the only drug that's now also generic. If you look at the prescription rates, you'll find it's not the older men who are getting prescribed Viagra. It's the younger men. They use it as a performance enhancer.
Yeah. Is there something about what a drug like Viagra can do and is supposed to do that we're misinformed about or don't understand? I think so.
Yes. Yeah, the biggest mistake that people make is thinking that Viagra will increase your arousal. It does not. It has nothing to do with arousal.
It increases what? Blood flow, I guess, right?
That's right. It reverses, especially as men age, our circulation patterns change. There's a specific hormone that's related to circulation of blood in the penis. It is the spongy material in the penis that has to become engorged with blood. That's what gives us erections. And so the Viagra and the other ED style drugs correct that hormonal problem that occurs as we age.
Well, if people, if guys could get their heads around that, they might be looking for where the real problem may rest. How much of, except for organic disease, how much of the problems associated with sex, in your opinion, are in our head?
Vast majority are psychological, I think. Mm-hmm. I mean, the organic problems are not hard to, they're not difficult to discern. I mean, we have excellent medical diagnostic tools. We can map blood flow. And of course, the majority, at least not so much in my experience, but in the experiences of my colleagues who work a lot with, for example, with war veterans, there's a whole separate field of sex therapy that involves working with people who have, for example, who are maybe paraplegic or even quadriplegic, or who have or have cancer or diabetes is a big issue for a lot of people. So there are certainly organic issues that can interfere with sexual functioning, but the majority of people in my clinical experience who come in with sexual issues, it's psychogenic. Typically, for males especially, if they come in with low sex drive and low sexual behaviors, of course, one of the first things I'll ask them to do is to get their testosterone checked, because there's no question that testosterone has a major influence on the experience of sexuality and on sexual arousal.
So let's kind of tie things up here with a couple of questions that are really just sort of opinions. But yours is a learned one. You mentioned pornography. You I take it, believe that it is presenting a problem for some people, a lot of people.
The major problem, in my opinion, with pornography has to do with the fact that we deny its existence and we don't teach about it. What do you think is the average age of males' exposure to very explicit internet porn?
At what age do I think they get to? I think it's probably very young at this point.
10.
Yeah.
10 years old.
Yeah.
So that's to me is a major problem. The problem is that, if anything, we're going backwards. If you look at states like Florida, we're denying any discussion about sexuality in schools. And you've got 10-year-olds who know nothing about fluffing. They don't understand what's going on. All they do is they see men pounding at women if it's heterosexual sex, and the women are having multiple orgasms, and they think that's what sex is about. And nobody, because we're denying, we're just saying, well, we refuse to deal with pornography other than vague attempts to try to outlaw it or whatever. But of course, that's never going to happen. But, nevertheless, we deny discussing it. We deny educating our children. Children need to be educated about pornography.
Well, and I read a post that you had recently, in fact, inspired me to call you about this topic, wherein you said that attitude that you've just described, this, we'll put a lid on it, you can't talk about it, is not unlike the way we thought we would treat drugs.
Right.
And kids have an innate suspicion of adults to begin with. If they say, don't look at this, I'm going to go look at it.
Quickest way to get someone to look at something, yeah.
And we're repeating that mistake. I guess you've answered my final question. And that is, at the end of the day, A, you believe the entire society and culture has been over-sexualized. And B, how big a problem is that?
I think our culture has always been quote unquote over-sexualized. I would say not so much over-sexualized as improperly sexualized, malfunctionally sexualized. So sex permeates everything. We all know that. I mean, it permeates advertising. It permeates our world, period. But what concerns me is the fact that we don't talk scientifically about sex. We don't talk honestly about sex. How old, what's the greatest love story that Western society has? Romeo and Juliet, right?
And they're both dead at the end.
Yeah. Well, they're both dead at the end. Had sex. And how old were they?
Teenagers.
16 and 14.
Yep.
Juliet was 14. So, and keeping in mind that up until the Industrial Revolution, it was and when the life expectancy was about 40, maybe. Mm-hmm. How can you be a grandparent at age 40 unless you're starting to have kids real early? Yeah. And that's exactly what happened when you reached puberty and a little bit beyond puberty, 13, 14 years old. Up until the Industrial Revolution, you learned a trade and you started a family. So there was no such, the term adolescence didn't even exist. There was right? No such thing.
Yeah.
Right? You were a kid and then you were an adult.
Yeah. People don't appreciate that childhood was a small transitory point in people's lives because they had to get very quickly to being productive so that they wouldn't starve to death. And adolescence, you're right, I've read this for years, is a total fiction of recent creation. Steve, Absolutely. This is great stuff. Finally, it's difficult for people to reach out for any kind of psychological, sometimes even medical help. They like to deny until it's too bad. Someone listening now who is having problems, what do you tell them? What do you tell them to get help? How do you do it?
Go to the ASECT website. ASECT is the American Association of Sexuality Educators, Counselors, and Therapists. The ASECT website, ASECT is the certifying agency in this country for sex education, sexuality counseling, and sex therapy. So you mentioned I'm a certified sex therapist. That's through ASECT. So there are several websites that will give you scientific, accurate information. So ASECT is one of them, which also will give you referrals. Another one is SSTAR. That's the Society for Sex Therapy and Research. That you can also get referrals through there. So ASECT, S*, and then finally, what we refer to as Quad S. All right. There's also SECUS. That's a governmental agency, but Quad S is SSSS. So, don't want to say S. So it's Quad S. That's a Society for the Scientific Study of Sexuality. Those are the resources that I send people to. And as far as referrals go, S* and ASECT is where you should turn to for qualified, credentialed sex therapists.
Terrific. I will reach out to you later, and you can give me all that, and I'll put it up on the site when your program airs. Dr. Steve Eichel, always a pleasure.
Thank you.
It's your second visit, but I hope you come back again and again. You're a terrific guest. Appreciate it.
Invite me and I will be there.
Thank you all. Thank you all for your attention. Don't forget, you hit the subscription button. It doesn't cost anything. We love that. And follow us on Facebook and look for us wherever finer podcasts are being had. See you next time on the Behavioral Corner. Take care.
Retreat Behavioral Health has proudly been serving the community for over 10 years. Here at Retreat, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 or visit us at www.retreatbehavioralhealth.com to begin your journey today.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.